What if the first sign of muscle loss after 60 is not looking thinner? What if it is the moment you push yourself out of a chair and realize your legs are doing more work than they used to? Or the moment stairs feel steeper than they once did? Or the moment you start holding the handrail, not because you are afraid, but because your body no longer feels quite as certain? Many people explain this away with one sentence: I'm just getting older. And sometimes, aging is part of the story, but it may not be the whole story. After 60, gradual weakness can sometimes be a quiet signal that your muscles are changing beneath the surface. Not suddenly, not dramatically, but slowly enough that you may not notice it until ordinary things begin to feel different. Today, we are talking about muscle loss after 60, why it matters, what it may be linked to, and when weakness is something worth discussing with your doctor. This does not replace medical advice, but it may help you better understand what your body could be telling you. One reason muscle loss is so easy to miss is that it usually arrives quietly. You do not wake up one morning unable to walk across the room. Instead, you adapt. You sit down more often. You avoid carrying heavy bags. You take the elevator instead of the stairs. You walk a little slower. You stop doing certain things, not because you made a big decision, but because they started feeling harder, and because the change is gradual. It can begin to feel normal, but weakness after 60 should not always be dismissed as just age. Doctors and researchers often use the word sarcopenia to describe age-related loss of muscle mass, strength, and physical function. The key word is function. This is not about having large muscles. It is not about looking young. It is not about bodybuilding. Muscle is what helps you rise from a chair, walk across a parking lot, carry groceries, climb stairs, steady yourself when you trip, and stay independent in daily life. So when muscle strength begins to decline, the first signs often show up in small, practical moments. A chair feels lower. A bag feels heavier. A walk feels longer. A step feels less secure. And for many older adults, those signs are easy to ignore. One of the biggest misconceptions is that weakness after 60 is inevitable and nothing can be done about it. That belief can make people wait too long before asking questions. Yes, the body changes with age. Muscle fibers change. Nerves and muscles may not communicate as efficiently as they once did. The body may become less responsive to some of the signals that help maintain muscle tissue. But age alone does not explain every case of weakness. In many people, weakness can be related to several things happening at once. Reduced movement is one of the most common. Maybe joint pain made walking uncomfortable. Maybe an illness kept you in bed for a while. Maybe surgery, fatigue, fear of falling, or a long sedentary routine slowly reduced your activity. Muscles respond to how much they are used. When they are challenged less, they can weaken over time. And this can create a difficult cycle. A little weakness leads to less movement. Less movement leads to more weakness. Then everyday activities begin to feel harder, and confidence starts to shrink. Nutrition may also play a role. As people get older, appetite can change. Some people eat less without realizing it. Others struggle with dental problems, digestion issues, medication side effects, loneliness, or health conditions that affect meals. When the body does not get enough overall nutrition, including enough protein from food, it can become harder to maintain muscle. This does not mean every older adult needs protein powder or special supplements. It means that if you are losing strength, losing weight without trying, or eating much less than before, it is worth bringing up with a healthcare professional. Blood sugar and nerve health can also matter. For people with diabetes or long-term blood sugar problems, nerve damage can sometimes affect the feet and legs. That may change balance, walking, sensation, and confidence. A person may say, "My legs feel weak," when the real picture may involve muscles, nerves, circulation, pain, medications, or several factors together. That is why it is important not to self-diagnose. Weakness is a clue, not a conclusion. Pain is another piece of the puzzle. If your knees, hips, back, or feet hurt, you naturally move less. You protect the painful area. You stop walking as far. You avoid certain movements. That response makes sense. But over time, less movement can lead to deconditioning, and deconditioning can make weakness worse. This is why muscle loss after 60 is not just a small inconvenience. It can affect balance. It can affect walking speed. It can affect confidence. It can affect the ability to recover after illness. And it can influence fall risk. Falls are one of the major health concerns for older adults, and muscle weakness can be one factor that makes a stumble harder to recover from. This does not mean weakness always leads to a fall. It means it deserves attention before it becomes a bigger limitation. So what should you notice? Pay attention if standing up from a chair takes more effort than it used to. Pay attention if you need your arms to push yourself up every time. Pay attention if stairs have become much harder, or if you avoid them completely. Notice if your walking pace has slowed. Notice if you feel less steady on uneven ground. Notice if carrying groceries, lifting laundry, or getting up from the floor has become more difficult. Also pay attention to near falls. A near fall is still information. It means your body had to work hard to recover balance. Unexplained weight loss is another sign worth taking seriously, especially if it comes with visible muscle loss, fatigue, or worsening weakness, and if you have numbness, tingling, burning, or loss of sensation in your feet. That should be discussed with a clinician as well. None of these signs mean you should panic. They mean your body is giving you information. The goal is not fear. The goal is awareness. For many older adults, the most helpful first step is simply to stop ignoring the pattern. If weakness is becoming noticeable, persistent, or limiting your daily life, it is worth asking, what might be contributing to this? Not what is wrong with me, not am I just too old, but what is my body trying to tell me, and who can help me understand it? There are also general habits that support muscle and mobility as we age. Regular movement matters. The body is designed to respond to use. Gentle walking, daily activity, balance work, and appropriate strength building exercises can all play a role, depending on your health and ability. For some people, that may mean structured exercise. For others, it may begin with safer, smaller movements and guidance from a doctor or physical therapist. The important point is that walking alone may not fully address strength and balance. Walking is valuable, but the muscles used to rise from a chair, climb stairs, steady the hips, and protect the knees also need attention. Balanced nutrition matters too. Meals that include enough protein and nutrient-rich foods can support overall health and muscle maintenance. Hydration matters. Sleep matters. Recovery matters. These are not magic cures. They are the foundation your body works from. Medication review is also important. Some medications may contribute to dizziness, fatigue, appetite changes, or balance problems in some people. That does not mean you should stop taking anything on your own. Never stop or change a medication without medical guidance. But if weakness, dizziness, or fatigue begin after a new medication or a dose change, it is reasonable to ask your doctor or a pharmacist to review it with you. So when should you talk to a doctor? If weakness is new, worsening, persistent, or interfering with daily activities, bring it up. If you have repeated falls, near falls, major balance changes, unexplained weight loss, numbness, tingling, or trouble walking, do not simply write it off. And if weakness comes on suddenly, especially with chest pain, shortness of breath, confusion, facial drooping, or weakness on one side of the body, seek urgent medical care. Those symptoms may point to something more serious and should not wait. The main lesson is simple. After 60, weakness is not always just aging. Sometimes it is a quiet signal that your muscles, nerves, nutrition, activity level, medications, or overall health deserve a closer look. Muscle is not just about strength. It is about freedom. It helps you stand, walk, balance, recover, and keep doing the ordinary things that make life independent. So if your body is beginning to feel weaker, do not ignore it, and do not blame yourself. Pay attention, ask questions, talk with a qualified healthcare professional, and remember that noticing the signal early is not fear-based, it is wise. If this explanation helped you understand your body a little more clearly, subscribe for more calm, practical health education after 60, we will continue looking at the quiet signals the aging body may send and what they may mean for your health, independence, and peace of mind.